Welcome to the Scholars Table. As usual, I'm your host, Dr. Banda Khalifa. Today, we're going to explore the world of MPH applications, admissions, and funding at the number one ranked School of Public Health. I understand that most of us, prospective students and applicants, would love to gain admission and several other tips on how to go through this process. So today, as usual, on this platform, I will help provide you with the knowledge and information that you need in order to navigate this process with confidence. For many of us, pursuing graduate school, it's a crucial step towards our aspirations and realization of our potential. If you are new to this table, the program is also streaming on YouTube, Facebook, and on LinkedIn. You can leave your comment and questions in the comment section, and we'll try our best to answer all of them. Today, we are very honored to have students' favorite professor and program chair, Professor Maridina West, who is Helena B. Margaret Morrell Professorship and Master of Public Health Program Chair. She has received numerous awards, including the Bloomberg School's Golden Apple Award. She's received this 4 times, which is usually given to exceptional teachers each year by students. She's well known for her excellence in teaching and mentoring students. She'll share with us today her experiences and insights about the MPH application, admission, and funding. She'll provide us with valuable tips and advice drawn from her extensive experience as faculty and chair of the program. Without wasting much time, let me invite Professor Barry Dida West.
Great. Well, thank you so much, Banda. It's a pleasure to be here, a pleasure to be here with all of you. I can see the comments in the guest chat. I can't see any of your faces, but I know that you're there.
Yes.
So, and I appreciate the opportunity to talk to you about both the MPH and the Johns Hopkins Bloomberg School of Public Health. And I'll just start by saying that I am a product of the School of Public Health. I have a PhD in biostatistics from the school, I'll say a number of decades ago. And one of the reasons I think that our school is number one, is the number one school of public health, is the people. So I've stayed around a very long time. And my husband as well. My husband has an MPH and a DRPH from the school, and he never left. I left for 3 years, and I came back after being out. I came back. It's the faculty and the students and the staff. It's a very collaborative environment, and I would say by far we're the most internationally focused school, I think, of public health in the world. So, it's really the people that have made us number one.
Yeah, I agree. I think the first time I got to Hopkins, I was amazed at how diverse the community is, from the faculty to students and the whole environment. I think it's really a great place to be. Thank you so much for agreeing to be here with us today. We have over 80 people watching, couple on LinkedIn. We have almost 20 on YouTube. And then we have a couple from Facebook. If you're having difficulty catching this live, you can check our YouTube channel. It's Dr. Banda Khalifa. It's also streaming. Let's dive in. I know, Professor, you don't have much time. We only have 1 hour, so we'll just dive into some of the questions that we have. So I guess you've told us what really distinguishes the Hopkins MPH from others. In your experience being part of the admissions committee and being a faculty, what do you think are really the key criteria or the admission criteria, or the qualities that the program is looking out for in applicants?
Well, great. That's a great question. And I think the first is that we are looking for individuals who have a passion for public health and who have had some experience and know a little bit, where they want to go with that passion. So that's why we do require at least 2 years of post baccalaureate health experience.
Hmm.
Medical school does count, but for those who have bachelor's degrees, we do require at least 2 years. And our admissions committee is really taking a very holistic approach. We're looking not just at grades and GPA, though we are looking at evidence of success academically to ensure
Hmm.
that the student would be successful in our MPH. But we're really looking for their personal journey. Their personal statement tells us a lot about where they've been and where they hope to go. And then the letters of recommendation are really important because they should be written by individuals who know you and know you well and know your aspirations and your strengths. And so we look, I would say we weight all of those fairly equally, but we really place a lot of attention on the personal statement and the letters.
Okay, so personal statement, recommendation letters, and if you're coming in with a bachelor's, you should have at least 2 years of some form of experience,
Right, some form of health related experience. It
health
doesn't need to be
related.
public health, but at least health, full-time health related experience. And that could mean working as a clinical research coordinator or working even as a laboratory technician
Hmm.
or working with a nonprofit organization, any number, or a health department, any number of agencies or organizations.
Okay, great. I think that has been summed up pretty clear. Thank you so much for that information. I know like Hopkins have been in existence for a very long time. Um, can you share with us any recent developments or innovative initiatives within the program?
So within the MPH program
Hmm.
itself, we have, as many of the schools of public health have, met our accrediting bodies criteria. So the CEPH, or Council on Education for Public Health, actually had criteria that made us change our curriculum a bit. And I think it's actually been for the better. We require that all students now get an exposure not just to quantitative methods, but qualitative, that
Hmm.
they have classes that teach them negotiation and mediation skills, classes that focus on health equity,
Hmm.
health advocacy, communication systems thinking. So we're not siloed anymore into epidemiology, health policy, management, and environmental health. We actually have competencies that all students gain through our criteria curriculum. So, so in terms of innovations in the program, we do have something called an MPH Field Experience Award that has been around for a while, but not for the 100+ years that the school has existed, in which students can gain travel funds to work on a practicum or applied learning experience during the winter break.
Hmm.
That is one thing that we do have, especially in the 11-month full-time program. There's not a lot of time off, and that
Yes.
winter break, can be useful for helping accomplish either a practicum, parts of a capstone, or field experience. But I would say that the most recent developments in our school that, of course, impact MPH students are we are the only school that has a Department of Mental Health. And
Hmm.
so we have quite a lot of focus on both wellness and mental health in the school. We we recently have incorporated a new office that's called IDARE, but that acronym stands for Inclusion, Diversity, Anti-Racism, and Equity. And they are allowing us as a school to look through a different lens in how we teach our courses, our seminars, the inclusivity of all. I feel like we've done a pretty good job in the past, but we now have we have a formal training in this, and and we always have new centers for students to align with in terms of faculty and projects. And our Center for Native American Health has become now the Center for Indigenous Health,
Mm-hmm.
which opens up,
Yeah.
right, opens up the category of these needs. So, and then lastly, I would say another center that's relatively new is the Center for Health Security.
Mm-hmm.
And this was
Yeah.
very prominent during the time of the COVID
Mm-hmm. Yeah.
pandemic. The director was actually seconded, if you will, to the government to work with them. So,
Amazing.
there's always an evolution
Yeah.
of different things.
Yes, and I mean, being away for just I think 2 years and coming back, I've seen a lot of changes, even in the MPH curriculum itself. So much
Yeah.
has changed, and I feel it's getting way better because it's now the curriculum now encompasses a lot of competencies that at least even if you are not concentrating, you are sure to get a very holistic view of what public health is. Um, well, as usual, most of my listeners are international students, and I know a couple of students who have gotten admission, and I know several others who are also preparing to put in the application for next cycle. Can you tell us any funding opportunities or scholarships available for international students? I know Hopkins is very generous when it comes to scholarship for international students, but can you give us a bit of what goes into making those decisions for applicants?
Sure. Thank you, Banda. So, students do not need to apply separately for internal scholarships. Rather, the MPH Admissions Committee, in their review for admissions, passes records on to an MPH Scholarship Committee, and they will then review the application and rank them for scholarships that might be Sommer Scholars, which are full
Mm-hmm.
tuition, to possibly 75%, 50%, 25% scholarships. The thing that everyone should know is that the admissions letter comes first and the scholarship letter comes later. And
Mm-hmm.
some schools do bundle those together, but in fact, ours are separate. So students are only beginning to hear about scholarships that have been awarded to them now. This will continue on a rolling basis
Mm-hmm.
until the end of March. So I would recommend everyone to be a bit patient if you have applied. Um, but we also do encourage everyone to look at external scholarships. And so there is a listing that's on our financial aid. If you go to the public health jhu.edu website and just put in the search financial aid, you'll see that you can scroll down to types of financial aid, including public health grants that can be applied for. There are also listings at the ASPPH, the Association of Schools and Programs of Public Health website. And if anyone wishes to email me, we also have an Excel file of funding sources that
Mm-hmm.
previous MPH students have applied for and gotten. And so those are ones that we encourage all students to look at as well.
Great. Well, you've heard from the program chair herself. I told you to come with your notebooks because it's going to be a session with a lot of information for you to keep. So you've at least gotten an idea about how the funding decisions are made. You don't have to apply separately for institutional funding. Your application also serves as your consideration for scholarship. So you have to ensure that whatever application you're putting in, it's strong enough to be considered for scholarships. Thank you so much for that information. Are there like unique partnerships or collaborations that the school has with other organizations or other entities that are not within the Bloomberg building?
Right. And so that can be answered in different ways.
Mm-hmm.
So we have a lot of partnerships with organizations in which students work with an organization or agency on their practicum or applied learning experience. So we can start local. We have over 100 community-based organizations in Baltimore that we partner with as a school. We also partner with some of the agencies or organizations in Washington, D.C. So we partner with health departments, both locally in Baltimore,
Mm-hmm.
and then also have done so in D.C. With some of the medical schools in DC, in addition to the Johns Hopkins Medical School. Um, and we've had some students who've been interested in U.S. health policy. And so it
Okay.
doesn't need to be a U.S. student, but an international student can actually do a health policy practicum with the House of Representatives in the state of Maryland, in Annapolis. So those are some rather local. We do have many connections of faculty who work with different countries and
Mm-hmm.
different organizations like the World Bank, Gavi,
Yeah.
the Global Alliance Group, WHO. And so there are times when students are able to get um, these winter internships at such organizations. So those are ways in which there can be applied experience for a student who has come to Baltimore for the MPH. I think the other is that we do have some partnerships with other universities. And so there is the Indian Institute of Health Management Research University,
Mm-hmm.
IIHMRU, in which we actually have a cooperative program in which students get a dual degree between that university and Johns Hopkins,
Mm-hmm.
Bloomberg School of Public Health, and they're based in Jaipur, India. So those are some of the international relationships we have as well.
Great, great. And I see like the community, it's very far-reaching. And the moment you're part of the community, you are given the opportunity to reach out to as many people as possible that you would like to work with. So that I can attest to that fact. So for international students, most of them would love to uh, get some experience after their program. Can you speak to the graduates' success in securing employment or perhaps furthering their education in public health? I, for me, I know like most of my mates that I completed with have secured employment, and most of the international students I know who graduated even this May, over 90% of them have gotten jobs. So just highlight a bit about how, if there are any numbers you can share with us about the employment opportunities out there for students that attend Hopkins.
Great. Thank you, Banda. So I think that number you gave, that percentage of 90%, is fairly accurate, both in talking about international students getting a job and on the, an OPT position
Mm-hmm.
after graduation. Typically, it's not in June. It might be in July or August because, it's a pretty intensive 11-month program.
Yeah.
So looking for that OPT position sometimes takes a while. And the same is true of other students who are getting jobs. I would say across the board, 90% have jobs by September. And part of this is helped by our career services office. So we have a career services office that's become even more active during the pandemic because
Mm-hmm.
it's able to bring in so many other employers via Zoom. Every March, there's a very large career fair where students can talk with representatives from different companies, organizations, and agencies. But now, even in addition to that, there are many Zoom type of calls where
Mm-hmm.
students can actually interview with different organizations throughout the
Organizations.
year.
Okay.
Yeah. So that is those are some of the ways in which students do move forward. And then we do have sometimes students who decide they want to go on for a doctoral degree right
Yeah.
away. And so, case in point, Dr. Banda, is in a DRPH program, PhD, sorry,
PhD.
PhD
Yes.
in EPI. But we have two pathways. One is the DRPH program, which is
Yes.
a part-time program, and then a PhD, which is full-time.
Yeah. Thank you so much for sharing that. I know when students reach out to me and say, we've graduated, we are not getting jobs. I tell them, eventually everyone gets jobs. So just
Just
calm
keep
down.
looking, right? Keep
Yes,
looking.
yes. Once you keep looking, you eventually find one. So for international students specifically, I know you've shared a couple of thoughts on how funding mechanisms are done at Hopkins and the other ways that they can assist. But the issue is that I think because of the pandemic, a lot of institutions that used to offer funding to international students are all withdrawing support. How does the program, for example, assist international students in navigating, the financial aid process or understanding the funding options available?
So I think, again, there's two ways. One is that the MPH internal scholarships are distributed by the MPH Scholarship Committee. I
Mm-hmm.
saw in the chat, mention of a Dean's Award. So we have some different named awards, the
Mm-hmm.
Dean's Scholarship, the Reed Frost Scholarship, et cetera. And so those are all just reviewed. That's based on review by the MPH Scholarship Committee. But in terms of navigating some of the other resources, including there are ways in which students might apply for US loans
Mm-hmm.
without a cosigner. And
Okay.
there is a way to go through the financial aid page, but there are certainly people who can be addressed. The first way is that there is a little bot, sort of can I help you? And they can
Mm-hmm.
direct you often to the actual link for these different types of things, such as public health grant or no cosigner, loan. But then there are contacts, under financial aid. It will say contact this individual, and they would be also willing to help navigate, because it can seem like a big mess in terms of a lot of information on a website.
Yeah.
But if you have
Mm-hmm.
a person explain it, and so just be sure to find the contact on the website and somebody would get back to you.
Okay. Thank you. Thank you so much. The for I know the program is extremely short and it's fast paced. So what opportunities are there for students who would want to get a hands-on experience or
Yes.
real world public health experience whilst doing their MPH program? Is such opportunities available at Hopkins?
Yes. And so, as Dr. Banda is saying, it is intense. And that's because everybody has several years of experience coming into this program. They actually hit the ground running when they start the program. And I, teaching biostatistics, can actually see students, not that I'm seeing light bulbs go on, but students have come up to me after class and they say, well, now I know why this method was used. Now I know why,
Yeah.
how I
Mm-hmm.
interpret this. And I think that's true of all classes. So although it's 5 8-week terms that go across 11 months, it is doable. I think that students learn a lot. But in addition, they have the time to do work with an agency for their practicum experience. And
Mm-hmm.
they also have time. Many students work 10 hours a week as a research assistant with
Yeah.
an investigator and a team. And so that really is, applied public health experience in the context of that 11-month period.
Yeah.
So every student that I've seen that has wanted to get an RA position has been able to do so. In early June, I send out an email to all of my faculty colleagues saying there's a bright new group of MPH students coming. Do you have any RA positions? And we
Okay.
post those. So, so the faculty and teams, teamwork is a really important part of this for most students.
Yes, yes, and for students who are looking for RA positions, I always tell them to keep looking because there are several opportunities available. Faculties are looking out for students to fill some of their projects. So if you only interested and you reach out, you will likely get options to help apply the knowledge that you're getting from the program. Still with the international students, for some people, I know it's become extremely difficult to get visas once they've gotten their I-20s. Are there any options for international students who, for example, are anxious about the start date of the program, even when they don't have their visas yet?
So great question. And I think, an example was last summer last spring and summer in 2022 was difficult because the pandemic was ending, if you will. The
Mm-hmm.
pandemic was winding down at that time. And there were long queues for visas because so many were in the queue from several years, before. I'm hopeful that this problem will not be as great this year. But what the best advice I can give is that our Office of International Services reaches out to an individual international student after they accept our offer of admission. And they usually recommend about 3 months in terms of then, getting a visa appointment and getting it processed. We have, though, um, in certain situations, we have had full-time students start online.
Mm-hmm.
So they've started for the 8-week summer term, which is
Yeah.
July and August online. And for a number of students last year, that gave them enough time to get the visa
The visa.
appointment, the visa, and then to join us in September. And then their 4 consecutive full-time terms were from September through May, which
Mm-hmm.
allows them to qualify for OPT
Okay.
afterwards.
Okay. So yeah. So as you've all heard, if you're struggling with securing visas, first of all, it's very important for you to start the process early. Work with the international students office, and if you've tried all options and it's not working, you can actually start your summer term online and then keep pushing for your visa. Um, so.
We recommend,
Mhm,
I don't want to interrupt you, but we do recommend that you start early so
mhm,
that then the possibility is higher, right? The probability is higher of being able to get the visa by summer, because we know summer is a really important time in terms of students networking with each other and really bonding as an MPH cohort.
mhm. Yeah. Okay. Yeah. So it's crucial to start early, because as Professor Adinawa said, the summer term is a time to meet your colleagues, especially now that most of the courses are on site. So for and still on international students, because I'm quite interested in international students, how does the program ensure that they have like the same uh, access to the resources and support on campus, despite the challenges of, for example, starting from their home country?
Yes. So if they start from their home country, we do pride ourselves on our online courses because our online course development was meant to simulate what you would have on an on-site
Mm-hmm.
course.
Okay.
So we have, many different, we have teaching assistants. Most of the lectures and other activities are asynchronous, so they allow the student to actually do the work when they wish, not at 2 a.m., which might be their time if they were um, participating in Baltimore. But I think the combination of the types of online courses that have been developed really allow students from across the globe. They were intentionally developed to allow students from across the globe to participate, to gain access to both TAs and faculty, and also to each other. So many of our courses have groups working together, and they are put together by time zone so that if you are in Ghana, you're working with others who are in your time zone as
Okay.
opposed to being 12 hours, difference. Um, So that's how I would answer in terms of online.
Online.
On site, there are other resources too. So we do have a course that's called English Writing for Academic Purposes, and so that is available in 2 terms for students for whom English is not their native language. And I do think that there's a little bit of a cultural difference sometimes that international students have to get over, and that
Yes.
is that they can actually approach their faculty and teaching assistants. So
Hmm.
no one should be shy about asking questions. That's why the teaching assistants and faculty are there. That's their purpose, to be able to aid students. And that the same can be said for online instruction.
Online. Okay,
Yeah.
great. Thank you so much for that. I mean, I know that there are several resources for international students to get really used to the system. So you wouldn't. Mhm.
No, and you know what? I'm sorry, Banda. I forgot the most important thing is that we do have an international student information day before orientation.
Mm-hmm.
And it's a wonderful session because it's led by students like Dr. Banda, who went
Yeah.
through the program and can share tips
Mm-hmm.
about getting used to the academic environment, but also where to go to buy, your favorite foods, or
Yeah.
to get a cell phone or get a driver's license.
Yes.
So
Yes. Mm-hmm.
that is a
Thank you.
resource
Thank you.
as well.
And I think one of the questions that I keep getting that perhaps I would love for you to uh, share thoughts on is that people feel, prospective students feel that most schools that are offering MPH are categorized under STEM.
Hmm. Hmm.
But when it comes to Hopkins, it's not regarded as a STEM, even if you're doing epibiostat concentration. Are there any options to change that, or is still going to be like that?
So we actually have made progress. So what we have done is actually gone through the procedures that are required for changing the code
Okay.
of our school to allow it to show that actually the numbers of credits in particular areas meets the fraction of what are considered to be STEM
Um,
qualified courses.
mhm.
And that was submitted to the Maryland Higher Education Commission, and I'm hope to have news that I can share very, very soon.
Okay, okay. Thank you so much to and exciting to know that you're working on this. So keep your fingers crossed. We may have some news very soon. We would like to take some questions from the audience. I know most of them, like we've answered it indirectly, but I would love us to take to look at a few of them. Um, we have a question from Martin. So Martin says, "Hello, Dr. Banda. I'm from South Sudan. I have a bachelor's of pharmacy. I have been a Red Cross volunteer for 7 years, where we supported a community responsive to disasters. Work to UNICEF. Okay, so I don't think.
He
Mhm.
doesn't have a question, but one of the questions you asked me previously, I should mention that there is on our website, the MPH website, a link to something called the Peter Salama Scholarship. And that scholarship is restricted to those from different countries, but
Okay,
South Sudan is one of them. So
okay.
I'd encourage you to, you don't need to apply, but that is something that you would be considered for simply because you're from South Sudan.
South Sudan. Okay.
Yeah.
So Martin, I guess you just wanted to show us your credentials. I think you are good. You can apply. And there are specific scholarship designed for students from South Sudan. We'll take another question from Michael. Michael says, "Hey, Dr. Banda, does the school have an online MPH which can potentially be funded?"
Yeah, so we have a part-time online program that can be done completely online, and anywhere up to 4 years as a maximum. But in terms of funding, our funding is not as strong internally for our part-time program as it is for our full-time program. And that's because most part-time students are working at the same time, so they have a source of income, but sometimes, depending on the employer, they might actually pay for some of the tuition as well.
Okay. Okay. So, Michael or Michelle, I hope you've gotten the response. We'll take one on Facebook. This is from forgive me if I'm not pronouncing your name well, Chijundi. He says, "Hi, Dr. Banda. I saw mention of a Dean's Award for MPH students with a good academic performance. Can we get a highlight on what this entails?"
Great. So, as I was mentioning with the scholarships that are awarded by our MPH Scholarship Committee, they have different names. And so the Dean's Scholarship is approximately a 25% scholarship. We have others with different names, but what it entails is that all of your credentials in an application are reviewed by the scholarship committee, and they have the very difficult task of trying to separate out, and assign different awards. But that is just one of the different kinds of awards that are given out.
Okay. Thank you for
And
that.
it's for tuition. It's for tuition only.
Okay. Okay. So, Chijundi, you've as you've rightly heard, so the Dean Scholarship is mainly for tuition, and it's the same process. They rank students and award to those who meet those criteria. We'll take some questions from. Okay, let's take this from Joel. Joel wants to know, what is the structure of the thesis of the Johns Hopkins MPH program?
Oh, yeah. Thank you for that question. So it's actually a paper. So we call it the MPH Capstone project, and it can take very many formats, but it's on the order of 20 pages or so. It's not 200 pages, it's not a thesis, but it should be a paper that is revolving around something you wouldn't have been able to do without developing your new MPH skills. It's under a one-on-one mentoring from a capstone advisor, a faculty advisor, or mentor. And it can range from being a data analysis of a research question written up as a research report and then hopefully subsequently published. It can be a grant proposal, a program evaluation, any number of things, or a combination of those. So it's quite broad, but it is meant to be for you to identify what you'd like to accomplish with new skills and do it in a mentored setting.
Okay, thank you, Joel. I hope you have your answer. I'm letting Professor Maradina West answer all these questions so that I wouldn't have to repeat myself again. So this is from Obed from Facebook. He's asking if the program is open for nurses.
Open for
Nurses. Nurse.
nurses, of
Yeah.
course, yes. So we do require that a nurse have 2 years of health-related experience as a nurse, but but a pharmacist. So we had a question earlier regarding someone with a Bachelor of Pharmacy. So having that with 2 years of experience does qualify you. And I would say that we have probably about 40% of our student body are physicians, pharmacists, nurses, medical students, veterinarians, so, and then the other 60% are coming from different backgrounds. But maybe I should go ahead and answer Haji's question about the basic qualifications for students again to enroll in the MPH. So it is the 2 years of health-related experience, unless you have an MD or a PhD already. It requires having some quantitative experience on your transcript. We often have to look at physicians and sort of see that that's in the preventive medicine or community medicine
Yes.
course. but also then have biology and a health-related science course. So those are the basic qualifications, along with having a great personal statement and great letters of recommendation.
Mm-hmm. Is there a hard stop, or is there a hard cutoff point for a GPA?
There is not. There is not a hard cutoff point for a grade point average, but what we do want to see, if somebody has had difficult grades, say in the
Mm-hmm.
beginning of their studies, and they've improved, that is
Improvements.
looked upon favorably, as opposed to having good grades and then decrease
Decrease.
over
Mhm.
time is not looked upon as favorably.
Okay. All right. So
And we do not require GREs. We do not require standardized test scores.
okay. So yeah, so that we don't require GREs. How about IELTS, like language proficiency tests?
We do require either the TOEFL or the IELTS or Duolingo. There are some other, another test too, that whose name I forget. But we do require English language proficiency tests unless the student's language of instruction at their school was English,
English. Okay. Okay.
and then
So
no
if
no test is required.
okay, great. So if you're a student from an English speaking country, for example, like Ghana or Nigeria, where English is a primary medium of communication or teaching, then you may not need to write any language proficiency test, right?
That's correct. That
Okay.
would be waived.
Okay. All right. So you don't have ILT to worry about. You don't have GRE to worry about. If your GPA is not in the first class range, and it shows improvements in your progress, you are still a good candidate to apply. Let's take one question from YouTube. This is from Mulukin. It says that it's a great honor to attend this event, and we are fortunate to have Professor Dina West. Yes. What are the names of internal scholarships provided for MPH and the amount of funding? I think this is a very loaded question. Maybe you can
Yeah,
just
it's
highlight a few.
so Mulukan, this is a little bit of a difficult question, because we do have some internal MPH funds that we give names to. Deans, Reed Frost, those were two chairs of epidemiology and biostatistics in the past, and they really are just honorific funding. Um, these are partial funding. The only one that really has full funding is the Somer Scholarship for tuition as well as stipend, the Peter Salama Scholarship for one scholarship for full tuition, and then we have some endowed scholarships that come from donors who
Mm-hmm.
actually then we give their names, so that the recipient can acknowledge in the future the family of the donor. But all of these decisions are based on the MPH Scholarship Committee's decisions. They
Okay.
make the awards.
Yeah. So, Mulukin, as you've heard, there are several internal scholarships with different names, and I mean, it's whatever you awarded is dependent on the decision that the scholarship committee arrives at. So that is that. I think we've answered some of the questions already from Popula. We've answered.
Well, Popula has a new question, and I think Joel asked as well about PhD students and
Yes.
funding. And I would love to describe that, because our school made a big change several years ago,
Mm-hmm.
in which the number of PhD students is smaller in each department than it was, say, 5 or 10 years ago. But each student gets full tuition funding, each PhD student.
Mm-hmm.
And that's true of each of the 10 departments in our
Okay.
school. Now, the requirements may require a GRE depending on the program. It may require sometimes personal interviews. So they may have different requirements. But the good news is, if you get selected, your tuition funding is covered.
Okay. Thank you so much for highlighting that. Yes, if you're a PhD applicant, once you get in, I think you're guaranteed of full funding. So that shouldn't be a problem. And I think some departments also offer some stipend support for at least 2 years. I know of epidemiology department. So thank you so much for that response. I think we'll take a couple more from LinkedIn, and then we'll call it a day. So, uh, question from Parisa. Parisa wants to know whether you need to contact a potential supervisor before applying for the MPH program.
Oh, excellent question. You do not. And so we try to make this easy, Parisa, in terms of when a full-time student starts, they actually are matched with a member of our faculty MPH executive board for the summer term, along with a group of other students who have similar interests. So they
Mm-hmm.
first have a summer advisor. Then they have an academic advisor, and then they get to choose their capstone, mentor for their culminating capstone project. So I like to think that each MPH student actually has a team of advisors, starting with the summer academic, as well as capstone. So I would recommend looking at faculty websites, so that you can approach faculty to discuss, both their research, maybe an RA position or capstone in the future. But it's best to wait to contact those faculty members, and we will make the assignment of the summer advisor for you, so you don't have to worry about it.
Okay. So as you've rightly heard, you don't have to identify an advisor before you enroll in the MPH program. Question from Oluwa Ferrami. Is the MPH program open for biochemists?
Well, so yes, I think so. So if you have a bachelor's degree, for example, in biochemistry, and you have a biology course and a health-related science course and math course, which you probably do, then the real issue would be the 2 years of health related experience. So that could be, maybe you're working in a pharmaceutical company as a biochemist, or you're using your skills in some other health related way. Then you would be eligible with those 2 years of health related experience.
Okay. So as you've rightly heard, the program is open to literally everybody who can show uh, the basic requirements. I've sat in class with journalists, lawyers, all sort of people with different backgrounds. So yes, you can apply. Um, we'll take a couple more from LinkedIn. Let's see. Okay, so somebody's asking from Martin, what kind of recommendation letters are required?
Mm. Yes. So thank you, Martin. So we require three, at least three, but typically it's three letters of recommendation. We like to see a mix of academic letters, meaning written, say, at least one letter written by a previous professor who you worked with, in your training, and then also professional letters. So these would be supervisors,
Mm-hmm.
in your current positions. So with those letters, it is important that they know something about you. And so I often recommend that a prospective student share their personal statement with the person who's going to write the letter, as well as maybe also their resume, so that there's a discussion that you have with a letter writer, so that they know what you've been doing since you may have last interacted with them, and also what your goals are for the future. So the best letters are written by people who know something about you, who know your strengths, who know your skills.
Okay, thank you so much for that. We'll take our last question from YouTube. That's from Emmanuel.
Okay.
So Emmanuel says, "Thank you so much for everything you do for prospective applicants. It's really nice having Professor Dina West with us. Do students have opportunities for graduate assistantships, and when?"
So great question, Emmanuel. We have so many synonyms for the same thing. So when we say research assistant, we really mean a graduate, assistant, or a graduate research assistant. So those opportunities that might be working either on a research project or possibly working on a practice project. So it might be working in the community, on a project. Those are available in the summer term. So, if you really see somebody you want to work with, you could email them. But usually, we post the descriptions of their available research assistantships, and you would then look through these listings and contact the faculty, after you arrive in July. So that's more efficient than trying to line up something in advance because
Hmm.
actually, when you think about it, we're in January right
Yeah.
now. There are going to be very different, research and practice opportunities available in the summer.
Yes, okay, that's true. So, Emmanuel, there are several opportunities, and I, for one, I was working with two different departments, Department of EP and Health Policy and Management, and I started my assistantship position uh, just after summertime. So, I mean, the summertime is not really recommended because you are now getting used to the system, getting to know your colleagues, and it's time for networking and all that. But you can subsequently start searching. Um, okay, so Martin wants to know academic or professional recommendation for.
So, yeah. So, Martin, in terms of three recommendations, it could be two academic and one professional, or one academic and two professional. You can mix and match. But we
Mhm.
usually like to see at least one, from each of those. No relatives, no clergy friends, no, no, so no spouses, so it should be somebody who, knows you from an academic or professional, really.
Okay, so as if I don't bring recommendation letters from your uncles and family members.
Right.
Uh,
Right, or
uh,
old family friends, right?
mhm.
None of those.
Yeah. Okay. Thank you so much. I think our time is almost up. I just want to take this opportunity to thank you for your time and accepting this invitation to share your wisdom with us. Your advice and the information you've provided and your experience will be very, very invaluable. Do you have any final thoughts for our prospective applicants and those who have already gained admission to Hopkins?
Yeah. So my advice would be for those who are working for admission, and have not heard yet or have heard and are still trying to find funding, that we will be having a number of virtual events in addition to the school MPH Admitted Students Day, which one will be virtual and one will be on site. But these will be if you've applied, they will be in your portal, and we'll look forward to seeing you then and have breakout rooms, and you'll be able to talk to MPH program office staff, and probably we'll bring in the Office of International Services, and possibly financial aid into one of those as well. And for those of you who are thinking about applying, the next cycle actually starts in the middle of August
Mm-hmm.
with a deadline of December 1st for the full time program in 2024.
Okay.
And Jagrup said, "What about the cover letter for PhD programs in the UK?" I really don't know to get external scholarship for graduate because funding is not available. I don't know so much, sorry, about external scholarships in the UK, but I would look at um, I would do a Google search. It's amazing what you can find sometimes on scholarships. You
Yes.
could say, scholarship for someone from a certain country to, study in the UK, graduate study in the UK, and that might allow you to identify some of these external scholarships.
Mm-hmm. Okay. Thank you so much, Professor Margina West, for joining us today. We really appreciate your time and insight with us. Um,
Well, it's been my
uh,
pleasure. Thank you, Dr. Banda. It's so good to see you,
yeah,
and
good
it's so
to see
nice
you.
to have the opportunity to interact with all of you, via this medium. So
Sure,
thanks
sure.
so much.
Thank you. Thank you. Bye bye.
Take care. Bye.
Bye.